ABCD has some other missions as well, including one that serves needs for better health care and jobs. It's the Community Health Worker Initiative, which is supported by money from local nonprofits and the federal government. To tell us about the program are its director, Kenya Elisa McLaren, and one of the recent graduates, Miriams Kitchen. Thank you very much for being with us.
Thank you.
I want to start with Kenya. We hear so much about budget cuts in Washington, so how does it look for this program right now?
Well, we've been very fortunate that despite the budget cuts, the agency, ABCD, has been able to offer another cycle of our new careers training program. So we are now recruiting for our third cycle of this program.
I'll tell you to give folks a reminder about that a little bit later on, but what kind of things do you teach people in this program?
Okay, so this is a community health work new careers training, and we are taking individuals who have an interest in doing outreach, becoming health educators, case managers, and training them in public health principles.
Miriams Kitchen, tell me how you got involved, and I guess maybe even what you did before you got involved with this program.
Yes, I actually worked at the Home for Little Wanderers as a child care counselor for about 10 years, rehabilitating abused children. Due to unfortunate circumstances and economic crisis, I lost my job. And I was already highly involved with ABCD, particularly with the Mission Hill site. And they had this program coming up, which was the first cycle. And people thought I'd be a good candidate for it because I already had basic experience before working with the community and youth.
So what did this program give you that you didn't have before?
Oh, a lot. It was a wonderful program. Even though I had experience, it helped me be more professional and help broaden my range of demographics of clients. I only worked with abused children, but going through this program helped me, understand addicts, people living with HIV, elderly, disabled, and so forth. And not only that, it helped me with my interviewing skills, and they helped me with my resume, and get really prepared to get out there and outreach in the manner which I wanted to.
Kenya, what about the record on this so far, as far as how many of the graduates actually find some kind of job when they come out?
So from our first cycle, Chris, out of the 28 students that we had, 23 of them were placed in permanent unsubsidized employment.
What about the difference this makes for the ability of these agencies? Are these agencies that would have found someone else just as good anyhow?
The advantage that agencies have by hiring our students is that when they complete our training, most of them have what's called a community outreach education certificate, and they get that through the Boston Public Health Commission's Center for Health Education Services. So our students come out with a professional credential that most employers will recognize and give them credit for.
By the way, are we talking about work in a classroom, work in the field?
When you say work?
In other words, do they maybe spend some time at an agency, almost like in an internship?
Okay, well, definitely. So with our training program, there are several components. They undergo their public health training through CHEC. They also undergo job readiness training. So we have job developers on staff who help them with interviewing, as Maria mentioned. So,
what about your experience in the training period, Maria? What was that like?
It was an adventure and very interesting, and it was amazing. The people there, we had such a diverse group, and the internship definitely helped me, prepare for a different type of field of work that I was doing. It was just, I'm very glad that I did it because, it added on to my resume and it gave me high credentials and it prepared me. And it was just, it's a big reason why I'm where I'm at now, to tell you the truth. With the job that I've gotten right now, and they saw that on my resume and was like, wow, you're like widely trained. And I was like, yes, I am. So they felt like I was very prepared to come into that group of clients.
Now, what about the job search? You had a job for a while, so that maybe you've gotten out of practice of searching for a job, which is a whole
We're talking 10 years.
Right.
10 years. So going back into interviewing was a very nervous thing. But like I said, this program prepped us to do that. We did intense interviewing training for maybe the last couple months of the program. We did a lot of role playing and stuff like that. So when I got in, it was wasn't really too new to me anymore because we already did it at the program, which prepped me, So I was very comfortable, which landed me the job I got now. So I'm was very grateful for that.
Kenya, this is not just a program for people who are very young and don't have families to raise. So how do you make this work for people who have these other things going on in their life?
Well, most of the students, they do have families, but they are committed to making this sacrifice for themselves. The training is during the day, so most of the children are in school or in daycare, and we finish early in the afternoon, so it's very family friendly.
Right. Maria, how did you find out about this program?
Like I said, I was involved with the ABCD program, and Mr. Hill, the director, Milia Bahe is my mentor, and I'm also on the board of directors. So when this had came up, she was saying, you know, why don't you try this? You're amazing at what you do. I'm a community activist, and I love rehabilitating, you know, people. That's my thing. So I took a shot for it. I figured it would look great for me.
Kenny, what about the backgrounds of people who come to this program? Because Maria seems to have a really solid background, but some people might be coming into this as a total change too, right?
Yes, and we do have many people who are doing a career exploration and try our new careers training. But they all have a passion for serving those who are in need.
And how long does this course go for once people get started?
It's approximately 16 weeks, full-time, Mondays through Friday, and they're in classroom 3 days a week, and then they're at their internship 2 days a week.
And by the way, what about the cost? Is that pretty much taken care of?
The best part of it, the cost is free.
And if they want to find out more, what should
they
they do?
Contact us at 617-348-6590, and we will send them a brochure. We have the brochure here, and they can feel free to give us a call.
All right, thank you very much, Kenya Elisa McLaren and Maria Amezquita.